Okay, so our presenter today is Jamie Leone. Jamie's a biology major. Going to tell us about animal-assisted therapy and occupational therapy, and she's interested in that because she is going to occupational therapy school starting in the fall at Lemoyne. So that's very exciting.
That is exciting.
Yeah. Very
Okay.
proud of you, Jamie.
Thank you.
Okay, go ahead.
So my capstone, I'm good. My capstone is on animal-assisted therapy in occupational therapy. My thesis is, while the current use of animal-assisted therapy in occupational therapy exists in limited settings, further development and protocols could be implemented on an individual level to support patient treatments in appropriate circumstances within a beneficial and safe environment. And so in a world that's evolving and modernizing, I think healthcare will continue to expand and animal-assisted therapy will progress further and more into the field of occupational therapy. So animal-assisted therapy is defined as a goal-oriented, planned, and structured therapeutic intervention directed and or delivered by healthcare, education, and human service professionals. Intervention progress is measured and it needs to be included in professional documentation. So animal-assisted therapy exists in many different settings that we're going to talk about in a minute. And the benefit in these settings helps us to understand the possible effects that more developed procedures can provide if incorporated into the occupational therapy field with more in-depth requirements and education. So this is a photo of an example of a therapy procedure with an animal. So here are some of the animal-assisted therapy settings that we'll talk about, and I think it's important to have the background of animal-assisted therapy first. So dog-assisted therapies can aid in the treatment of psychiatric disorders, physical and mental disabilities, individuals diagnosed with cerebral palsy, autism, dementia, and more. These patients often have the most to gain from successful rehabilitation treatments, as it has a very significant effect on their lives. So dog-assisted therapies are the most common forms of therapies in animal-assisted therapies due to their more relaxed demeanor compared to other animals, and they're a lot more accessible. So animal-assisted therapies are growing in schools. A lot of schools are having occupational therapists work with certain populations of students. Many schools have class pets and things that animals that influence therapeutic aspects of school. In my elementary school, we had a class pet, and I think it was a hamster or some sort of animal, but that was served as a motivation. Everybody wanted to be able to take the class pet home for a holiday or the weekend break. In colleges, animal-assisted therapy is present. A lot of places schedule stress relief events where they bring in animals during finals week or events when students are really, really stressed out and need a break from their studies. And these are found to have positive effects. These animal-assisted therapies aren't always occupational therapy, but I think their effects are still really relevant in seeing how these can affect occupational therapy moving forward. And horses are another setting of animal-assisted therapy, therapeutic riding, and hippotherapy. Hippotherapy is specifically in occupational therapy, and we'll talk about it moving forward. But these programs for equine therapies, I think it's important to note, have dated back to helping patients with disabilities since the 1960s. And there's other settings of animal-assisted therapies with other animals as well, but these are kind of the main therapies that I set on, is with dogs and horses because they're more common. So then we need to talk about occupational therapy. Occupational therapy is a rehabilitative, goal-oriented treatment. Treatment uses creative approaches that are based on not only what a patient might need, but also things they might want to safely accomplish and goals they might have. So occupational therapy treatment focuses on occupations. These occupations aren't always incorporated with their jobs, but occupations just refer to an activity of daily living and something a patient might do in their everyday life. These often have big influences on their quality of life, and occupational therapy seeks to gain an enhanced quality of life. These are highly individualized treatments. Every patient is different. There are things that will work for certain patients that won't work for others. There's many settings across the lifespan. So this goes from children to adults, geriatrics, mental health settings, and the treatment itself may be temporary, but the activities that are incorporated into the treatment are a part of the daily life, and they become permanent in a patient's lifestyle. And treatment is based off of evidence-based practices, which have a really big emphasis on research, which is why the research we study in this capstone and that I'm going to tell you about is really important moving forward in developing animal-assisted therapy and occupational therapy. So now we can talk about animal-assisted therapy and occupational therapy. In occupational therapy, they use many forms of equipment and transitional objects. A transitional object is an object between the therapist and the patient that can enhance the relationship, and animals can be the sort of transitional object. It's something for the patient to relate to with the therapist, and it increases their interaction with the patient, and it also can maximize therapy outcomes. Some therapies can be, in occupational therapy and treatments, can be frustrating at times, and the animals can provide a distraction from these frustrations and the stress of daily life, and they can kind of make it not seem like as much of a chore. And animal-assisted therapy and occupational therapy needs to also focus on purposeful activities. A purposeful activity in occupational therapy is something that is achieving a goal. But if animals can be incorporated, this treatment can be enjoyed more by some patients. And if the treatment is enjoyed personally by the patient, they're more likely to be involved in the treatment. They're more likely to be motivated, and the treatment is more likely to be effective. So in this study by Velda and other authors, occupational therapists saw an increase in motivation with animal interaction. The therapists believed animal-assisted therapy was most effective when utilized by an individual already capable of successful occupational therapy. And that's a really important concept, that the individual is qualified in what they do in both aspects, not just the animal-assisted therapy or the occupational therapy. And these therapists reviewed in the study viewed animals as a modality for engagement in occupational therapy treatment, so something to allow the patient to be more involved. A limit of this study, though, is that there were only 2 occupational therapists reviewed. This is a small number, but in my experience, many of the occupational therapists I've come into contact with have also viewed animal-assisted therapy in occupational therapy as in a really positive light. So next, this is an example. This chart is an example of how an animal can be incorporated into an occupational therapy treatment. If we look in the middle section, it compares a traditional treatment with an animal-assisted therapy treatment in occupational therapy. So for the goal-directed activities, the dog can be included with just free play with the animal. It can be included with, if you have an animal or a patient sit on a beanbag chair, the dog can sit on the beanbag chair with the patient on their lap and serve kind of as the weighted blanket. And also, it's been found that the warmth of the animal has physical effects. An individual can do yoga poses with the animal and make a collar for the animal. In the bottom half of the chart, you can listen to music with the animal, read the book to the dog. I know dog-assisted reading programs have had really positive effects for students and patients. And even something as simple as high-fiving with the dog instead of the therapist can incorporate muscle activities. So next is hippotherapy. This, we mentioned earlier, this is occupational therapy with a horse. It can be physical therapy, occupational therapy, or speech and language pathology therapists also conduct hippotherapy. This is a fairly established field in occupational therapy, more established than, I would say, the dog-assisted therapies I've researched. So this serves to treat neuromuscular functional impediments by applying equine movement. So a lot of individuals who have cerebral palsy may be treated with hippotherapy. And I think hippotherapy being so developed gives credibility to animal-assisted therapy in occupational therapy. I think animal-assisted therapy is viewed as emerging and recent, but it's really been around for a while, as horses in therapy have been around, as I said, since the 1960s. And this is different from therapeutic riding, as this is specifically conducted by a physical, occupational, or speech therapist, and therapeutic riding can be recommended by a physical or occupational therapist or another healthcare professional, but it's not always conducted by them. And I think this photo just really shows on the left, just shows some of the benefits that you can have in posture, which is a big part of research in hippotherapy treatments. From experience from riding horses, my posture is way better and certain muscles are strengthened when I'm riding more than when I'm not. So now we're going to move on to some of the results that are seen specifically in the studies. The first study is a study by Amachi and Savici. This is at a rehabilitation center in Turkey for dog-assisted therapies in children with cerebral palsy and physical and mental disabilities. The patients ranged from 4 through 23 years of age. They were divided into 5 different groups with different occupational therapy goals, and they were presented with 3 different therapy dogs. This is an actual photo from the study, and these different goals in occupational therapy for the patients were reducing fear and anxiety or stress from medical procedures in the hospital, because many of these patients had extensive hospital records and had to go through many medical procedures, and that can be scary for someone so young. Another goal was to increase motility or use of the side of the body, increase muscle activities or hand skills, increase balance, communication, empathy skills, and to avoid contracture for this patient in the photo. Contracture is the hardening and shortening of your muscles from certain conditions and not being able to use them effectively. And this individual also needed an increase in his mobility for digestion. And so doing certain activities with the therapy dog really helped. Just laying with the dog, the warmth of the dog really had an effect on his digestion as well, which was really interesting to read on, and it had an effect on his muscle tone too. So some other useful activities other than laying with the dog that were used in the study were for the emotional purposes, touching or petting the dog. Also for the patients who were really scared of the medical procedures, they actually incorporated that they have the children pretend to perform procedures that they would have to go through, like put a Band-Aid on the therapy dog and things like that. And it made it seem a lot less scary for them when they were going through it. They could also feed and play with the dog for muscle activities and mobility purposes. They could play with a football and throw the football for the dog. And even something as simple as feeding the dog really uses their hand muscles and things like that. So the the children gained confidence, empathy, and improved communication as well. However, a limit in this study was that it's hard to describe in data how they gained their confidence and empathy, as this wasn't really quantified in the study. The sample size was also small. It was 10 patients, and there was no control group in this study. So there were a lot of problems with this study that need to be fixed moving forward, but it still provides valid insight on the effects that animal-assisted therapy and occupational therapy can provide, and it gives a foundation to build on. So the next study, which did have a control group and had about the same sample size, but was a little further along in the research, was this study by Feinstein. And it was a study on human-animal interaction to assess changes in playfulness and participation of, again, children patients in the pediatric field. And these patients had developmental disabilities, and they had, in the study, they used a scale to it was called the Test of Playfulness Scale, which is actually a study or a documentation method used for other procedures that they've learned to use for this study in animal-assisted therapy. And extensive measures were used to prevent bias in this. They even brought in different OTs from the study and taught them how to use the scale to really have someone else assess the effects without having their own bias present in quantifying the data, which is hard to do. So this study saw an increase in average playfulness and participation of patients who underwent animal-assisted therapy. They had about 80% playfulness increase based off of this scaled documentation, and they actually used statistics to measure how large the effect was, and 60% of the effects of the increase in average playfulness were medium and large effects. So they weren't just small differences, these were big differences that were noticed. And for 90% increase in participation that was seen, 70% of that was a very large effect size, which I think was for this study, only about one standard deviation above the average, which is kind of hard to assess, but their data showed a statistical significance, which was good to take off of. And so the control part of this study was important because it was really unique in that they gave traditional OT for different lengths of time before introducing the animal-assisted therapy. And they did this because other concurrent therapies like physical therapy and speech therapy couldn't be stopped just for this experiment for the patients. So by varying the length of time that animal-assisted therapy was involved, they could really see what effects were coming around when animal-assisted therapy was conducted. And it was determined that these increases in playfulness and participation were due mostly to animal-assisted therapy because of this timeline that they used. So this is another study for children with autism spectrum disorder by Lambias, and it was a study on engagement in meaningful activities, which was determined to be a really big aspect of treatment for children with autism in occupational therapy. And so this was, again, a small study, but 7 patients between the ages of 4 and 8 years old, and it included an exclusion criteria. So some of this exclusion criteria was that the participants had to have no previous riding experience, because this was a horseback riding study, no previous riding experience greater than or equal to 3 months. They had to have no fear of animals, not exhibit aggressive behavior, because this could be a safety concern around the animals. And they excluded patients that had comorbidities that could influence the results. And a comorbidity is another diagnosis that could affect their outcomes. So these occupational therapy activities were conducted on and off the horse, and the average baseline of their engagement, which is basically their participation and involvement, was between 51 to 77%, and that's with no animal-assisted therapy. But when the horses were introduced, the average engagement was data determined to be up to 95% and 99%, which is a huge increase. And not only did they use quantified data, but they used qualitative data as well. So this descriptive info came from parents and teachers to also give kind of the results. And it was documented that they had an increased interest, enjoyment, and improvement. And many of the teachers and parents said that the students had, well, from the school setting, the teacher said that some of their students had their best day in classes and work after this activity with the horses. Like the day after this activity, they were just doing really well. So this study also included, though, an emphasis on occupational therapy techniques and theory. They decided that it's really important in animal-assisted therapy to relate it back to occupational therapy. You can't just do one, it has to incorporate both, and the theory of occupational therapy has to be involved in the animal-assisted therapy treatment. So those were all studies on kids. These are some studies that I researched on adults. So adults with mental illness, a study reviewed pet ownership as a meaningful occupation. And this study defined an occupation could be as simple as just walking the dog. And for an individual with mental illness, sometimes it's really easy for them to become isolated and, get out of a routine. And something as simple as walking the dog could increase them being involved in their community and physically out in the community, and which would enhance their social engagement and increase that as well. They'd be around people more, be outside more, and the care for the animal would give them a routine to keep, have them set in their life. And there was another study based on a therapeutic riding program for a veteran with a spinal cord injury. The movement of the horse is similar to the walking motion of humans. So someone who needs to build strength can build strength walking on a horse, and build more strength to be able to walk on their own from that, while exerting less energy in the process of it until they're strong enough to on their own. So this therapeutic riding program was not conducted by an occupational therapist, but it was recommended by the patient's occupational therapist. And I think the effects of this are really important to be seen moving forward for hippotherapy and things like that, because there were really good physical and emotional benefits for the veteran. And he spoke for himself by saying that it gave him a sense of independence. He was non-ambulatory, which means he cannot move around independently on his own without help. And so this gave him a sense of control and something that he could do on his own by controlling the horse. So another study is for dog therapy for cases of dementia in elderly patients. And this dog visitation or animal therapy can provide not human contact, but contact that may be missing for dementia patients and elderly patients. There's a high emphasis on the importance of physical contact for just human nature, and that can be absent sometimes in residential facilities. And so dog therapy for cases of dementia, it was stated in the study too that some individuals recalled memories that they wouldn't otherwise have remembered just by sparking that by seeing the therapy dog. And they saw stimulated socialization, reduced agitation and outbursts, and it gave them a topic to interact on with the handler performing the therapy. It was even seen that this is a physical effect, but it was seen that they had a reduction in heart rate, which is corresponds to a very calming effect. So the problem with this study, though, is that this was all determined, all these effects of stimulated socialization and reduced agitation and outbursts. These were assessed on a scale that was made, but the scale was not straightforwardly described in the study, which makes it really hard to use this data moving forward, even though all the positive effects were there. So in order to move the field forward, we need to address the overall limitations of the studies. For research concerns, the small sample size is something that many claim needs to be changed in further research. I think that, however, the small sample size is going to be consistent due to the really individualized nature of the practice. Everything is different for each individual in occupational therapy, and it's determined on a case-by-case basis. And I think that case studies are more important because we need to see the overall effects for each individual specifically. So the one study had no control, which is a research concern we talked about. The quantification of data can be difficult. And also in some studies, there wasn't a very big description of the animal being used in therapy or the handler's qualifications and criteria. And it was addressed that this needs to be described more moving forward in order to assess the safety of the research as well and experiment. Another thing to consider is that in these research studies, most participants in an animal-assisted therapy study are willing to be involved in the study. They're willing to undergo animal-assisted therapy. And if you're more willing to be involved, you are more likely to see positive effects. So this is something to consider as well. In practicing animal-assisted therapy and occupational therapy, moving forward, we need to address that there are sanitation concerns. Animals can transport diseases, and it would be required that there's vaccinations that need to be documented for the animals, and like things like flea and tick medicine. These all need to be documented that the animal has been up to date on these and on shots. Some individuals, they have really bad allergies to animals, and in some facilities, you may not be able to bring an animal into that facility at all. So that needs to be considered as well. The safety for everyone involved is really important, not just the patient, but for the animal as well and for the handler. So this is why education for the handler is really important in an OT aspect and in an animal assisted therapy aspect. So some people just don't like animals as well. That's another concern. This isn't animal assisted therapy isn't going to be for everybody, but that doesn't mean the positive effects are any less meaningful. It just means it's going to be for some patients more than others. And another thing to consider, which I found really interesting, is that you don't always think about this, but at some point, a therapy animal may pass away. And if a patient has developed a close relationship with that animal, that is going to be something that's hard for them to deal with. And there has to be guidelines and procedures on how to help them cope with that loss. And the American Occupational Therapy Association does have some information and articles on its website on how occupational therapists can support their patients in a time like that. So in discussing the further implementation of animal-assisted therapy and occupational therapy, it's important to consider the documentation necessary. Occupational therapy documents a lot of progress for patients, and so animal-assisted therapy and occupational therapy would need that as well. The lifetime performance model, there's a photo right on the side of it that shows how pet therapy can be incorporated specifically into occupational therapy. And so these are the different categories involved in treatment that are related to an individual's daily activities. And it shows that ways that these activities can involve pets to benefit the patient. So you could have for a societal contribution to fulfill a patient's needs, you could have that individual contributing to the welfare of the pet. You could have pet-related activities that an individual really likes and enjoys to satisfy intrinsic gratification. And these all are a part of the patient's environment and daily activities. There's also, for hippotherapy, there's the hippotherapy evaluation and assessment tool, and that is made recently specifically to assess hippotherapy, and it involves a scoring process, which is really important because it allows the data to be quantified. So that is also another possibility moving forward. And the lived environment life quality model really gives some insight into animal-assisted therapy and occupational therapy. It's a review of a multitude of studies to get all of the information in one place and to help expand guidelines of practice and research moving forward. And so this focuses on the quality of life of residential patients with dementia or Alzheimer's disease. And the model actually found 10 studies with positive outcomes for dog-assisted therapies that experienced statistical significance, which is really important in the research. So these can all be considered moving forward to help develop better policies and procedures. Also moving forward, insurance aspects are really important. Most insurances only cover more traditional practices, and animal-assisted therapy is mostly a non-traditional practice. So I found that many private insurances are less likely to cover hippotherapy or animal-assisted therapy. They consider both to be investigational treatment, which I found really interesting for hippotherapy because there is research on it that explains its effects. But they also claim problems in the methods of research, which is really important that we addressed the research limitations so that these can be fixed moving forward, so insurance has a better formula to like provide claims on and things like that. it is covered by some companies. Medicaid and a form of military insurance cover both hippotherapy and pet therapy for certain diagnoses, such as cerebral palsy, autism, and emotional abuse even. However, this needs to be more consistent moving forward in order for animal-assisted therapy to really expand. And then another thing that can help expand moving forward is the certification process, which is actually being looked at right now by the American Occupational Therapy Association. So individuals have to take a board exam to be an occupational therapist, and now they are developing new areas of specialty certification that an occupational therapist can achieve by taking another form of a board exam and certification exam. So these areas, one area is going to specifically be pediatrics. So it can be assumed another would be an aspect like mental health or something like that. But if animal-assisted therapy was to be considered for a certification like that, it would really give more credibility to the field, and it would provide a safer environment by having individuals being more educated on it, and it would provide more criteria to go off of. So these new areas of specialty certification are actually currently being determined, and they're taking suggestions from the public right now. And so I think this is really important because not only would it allow the field to expand more with more credibility, but it would also give insurance a basis to have to cover some more of these procedures as medical treatments. And so that is my information. I should have left a slide for questions. Oh, and it wasn't on my face the whole time.